Okay, Rich, thank you so much for willing to share your experience
My pleasure.
with the stem cell procedure with us. I really appreciate it.
Oh, you're welcome. My pleasure.
And hopefully this will be helpful for many other people who suffer from pain.
Yes.
And they might have tried the traditional way of, the cortisol shots or the pills, the drugs, all of that stuff.
Absolutely.
And it didn't give them the relief that they wanted. So how did you feel? What made you think about getting the stem cell procedure? How were you doing before that?
Oh, I was in excruciating pain. The VA would only give me oxycodone to ease the pain.
What was the thing that was hurting you the most?
My lower back.
Lower back.
My lower back. My knee and my lower back, with the nerve blocks on my knee, my lower back, and the doctor was actually going to do another nerve block on my back. And then I told her, wait a minute, I'm going to get stem cells. And she didn't want to do a nerve block and have it not, she said, let's get clear on what the stem cells do. I don't want to do a nerve block and have that, not knowing which is which, so you know what the stem cells are doing.
How would you describe your pain?
Oh, usually around a 7,
Seven
maybe
out of
8.
10.
Yeah, 7 or 8, yeah. And I had to walk with a cane, my walker. Every time I had to get up, I was in a lot of pain, and everything that is, done was just temporary.
Yeah, it's like
The drugs, everything was, I didn't have any permanent, and they said, the only permanent solution, this is doctors, they said, the only permanent solution is to get a knee replacement.
And what was your concern about doing such a big surgery?
Oh, just the horror stories I heard, the infections, especially with bigger people. I was still going to be in pain, and I was going to have this chunk of metal in my body that wasn't going to help me. And then that once you make that decision and have that knee replacement done, it's irreversible. It's not like you can, I didn't really like that. Let's go ahead and pull it out. Put your original. You can't do that. So it's so I was really looking for something, and I saw I think it was on Facebook that I saw your seminar advertised down in Salem.
For the stem cell program.
For stem cells, yes. And so we went and saw you probably 6 months ago, I think, the first time. And we brought a number of friends to see your seminars, and we were trying to figure out, my wife came in and we did a consultation on her. And
Was there anything, you were talking about the knee pain and the back pain, was that holding you back from doing anything that you wanted to do, like activity-wise, or?
We couldn't, we have people out, and, we bought our house, and since we moved in, our health has just gone downhill, and it has a huge studio, and I can't even go out and work in the workshop, and I just go out there, and it just breaks my heart that I can't do anything out there. Yeah, normal living,
So you had all the knee pain, the back pain, the arthritis,
and my shoulders.
How did that affect when you're trying to walk, or?
Oh, we can't even, when we're outside, we see neighbors that are out walking, and my wife and I have said, I can't wait until we can, go walk around the neighborhood, but we can't, even walk a block, without being in severe pain.
It sounds like that inflammation and degeneration has
Yes.
just affected so many joints. You couldn't even enjoy the things you love anymore inside your house.
Exactly.
Just doing the art that you love doing. And you just had your procedure done just a few days ago, just recently. And
6 days.
Just 6 days. So how was your experience so far?
Oh my God, what a difference! I wasn't expecting anything 6 days out. I really wasn't. I thought, these little stem cells. They, from what reading I'd done, they said, maybe 3 to 6 weeks you'll start to feel something. So I really wasn't expecting much of anything. But like when I got out of bed this morning, I actually didn't feel any pain It's starting to get a little tender now, but I've been up. I drove 2 hours to get up here, and so it's starting to get a little tender, but it's nowhere near the pain level that I normally used to feel.
And I remember even just walking in today, and you came in for us to see you in a seminar. You're walking without a cane, and just walking so much better than I've
absolutely,
seen you before,
absolutely.
which is incredible. How's your back feeling differently?
Back feels better. It's not as good as the knee, but it does. I do feel some relief there.
Any change with your the arthritis?
Yeah. Oh yeah. My hands aren't. I still feel some pain. My feet, I've noticed. Usually, by this time of the day, I'm starting to feel some pain as I walk around in my feet from the arthritis, and I'm not feeling that. I think, and once we get to going out to the Croc Center and working out, working on the exercise bikes and doing walking out there, I think that's going to really help. One of the things I'm looking forward to is being able to actually go in, because then once you're not in that pain, you can go and get the muscles built up, and you do the things you need to do to get. I mean, it's not like you just get the stem cells and you just lay there and okay, I'm going to be all better. I think it's you working with your body, taking the right nutrients and doing things like that. That's going to get you well, not just the not just the stem cells, but I think they give you. I think they're the vehicle to get you to where you can exercise and do the right things and start living life again.
Yeah. So now that and it's still early phase, like you said, it's just 6 days. Most patients within the 3 to 6 weeks, they start seeing with these really amazing stem cells, and they start noticing change as they tell us. We hear these stories all the time, and with you, the knee got so much better, the back is doing better, heading in the right direction, the arthritis went down, the shoulder point. How does it make you feel knowing that you before you had this procedure you couldn't even do art or walk properly, and now you're allowing your body to heal and you can start doing things? How does that make you feel?
Hopeful, and before I kind of sunk into despair, remembering the things that we used to do, and my wife and I, when we were traveling vendors, even going, we were talking about, we haven't been, we live in Salem, and we've talked about going and walking on the beach, and we haven't. We've lived in Salem for 5 years now, and we haven't been able to go walk on the beach because neither one of us can really stand the pain, and you can't, a walker or a cane doesn't work too good in sand. But it's like that's just small things like that. That was one of the things that we talked about. Oh, we can start walking on the beach, and then we haven't been able to do that. We haven't been able to do many things.
So, if somebody is watching this, let's say they're in a lot of pain, and they might have heard about this new type of stem cell or the type of stem cell program, because it's recently new, as we know. And they really tried everything out there. They're still suffering. It might impact their quality of life. They want to, be able to enjoy life, and they're suffering every day. What would your recommendation be for them, based on your experience?
Absolutely, come and get a consultation from Dr. Cohen at New Way Clinic.
So when you look at your future right now, knowing that just in these last 6 days you already saw so much relief.
Yes.
How does your future look like when you look at it right now?
I'm looking forward to doing the, being able to, there have been a couple of concerts that we've wanted to go to, sporting events, or, like I said, go walk on the beach over in Oregon. Has such beautiful beaches, and just, we like to, when we were down in California, we used to go to the beach, and we'd stop in the little towns and go, look through the little gift shops and see what cool stuff they had. And we haven't done that in many years because it's just too painful to walk. I'm like I said, I'm really surprised. I really wasn't expecting to feel much 6 days out from from when I started the injections.
Yeah. It looks like you're doing really great.
Oh, much
even,
better. Yes,
even
yes,
despite
yes,
like
yes.
two days of driving,
Yes.
which is just
Well, actually,
incredible.
4 days of driving.
4 days. Of driving.
2 days down, 2 days back. So yeah, it was a lot of driving.
That's incredible. And looking into the future, it looks brighter. This is exactly what gets us so excited, and because I know that some patients might go to doctors and they suffer from pain, and some doctors might say, well, only surgery can help you.
Yeah.
And it's we always tell patients surgery, it's good to have that option, but the reality of it is that there are other things out there that everybody should at least consider, before they go into surgery.
Oh, absolutely. And for me, the thing is, they put a needle in my arm, and they did the injection, and I walked out of there, went out to dinner, and I went to my motel room, and that was my recovery time.
Yeah, absolutely. So I'm so happy that you went through I would definitely call it a safer, more simple route.
Oh.
And that helps your body recover instead of cutting open and removing different joints.
Mm-hmm.
I mean, this is way easier. It's way more simple. I mean, just seeing you walk in here today, because I didn't expect you to come into the seminar today, but just seeing you walk in here today, and I saw Deborah, your wife, first, and she was like, he's like a new person. This is like a whole different person, which is, I mean, just to me, that tells me so much. I know it's just 6 days, and it's a process, but this just tells me so much. I really want to thank you for sharing this. I really appreciate it, Rich.
Yeah, I so appreciate the...
Yeah, thank you so much.
All right, thank you.
Yeah, absolutely.